Okay. All right. Well, again, welcome everyone to Pediatric Teaching. And today I just wanted to give an overview of the pediatric curriculum and training this year. And it's similar to the lecture I gave last year, but with a few differences. The first thing is that this really covers both DCHN, MED type training, and I'm just going to give an outline of the pediatric training curriculum, the sorts of content that you would learn. I might just mute somebody who's online. Alina, could you perhaps mute your device so that others can hear? Thanks, Alina. So I'm going to give an outline of the pediatric training curriculum, just the course content. I'm going to talk a bit more about the many ways in which we can learn, because I think what's important is not so much learning about the topics, but also understanding the ways in which we can learn. I'm going to talk a bit about supervision and mentorship and teaching those types of concepts, because your supervisors will, are very important to you in your training. And to say something like it's a marathon, not a sprint. Pediatric training, any postgraduate training takes a long time, and you need to just accumulate learning over time. We'll talk more about that. Last year, these are the lectures, most of the lectures, there's a few more, but these are most of the lectures that we went through last year. And as you can see, a wide variety of topics. That's not the whole of the pediatric content of the curriculum. There's clearly more topics than this, but that was the basis of it last year. We'll go through most of these lectures again, but also many different lectures, because these are all online. Most of these you can watch the lectures online at your leisure, but we'll add some more again this year. I won't go through them all, but you can see the common diseases: pneumonia and acute respiratory infection and meningitis and anemia and heart problems and kidney problems and child development and neurological problems, HIV, TB, etc. So all of these form the topics that we'll talk about in 2023. But the pediatric curriculum is not just about diseases. And I guess we need to think about how we become doctors that not just have a good knowledge of diseases and pediatric illnesses, but also how we become pediatricians who are child and family focused, who know how to think critically. And I hope that throughout your training, both this year and in subsequent years, you'll learn the skills of deductive reasoning, which is a way in which you can think critically about a problem and try to solve a problem. Most of pediatrics is about trying to solve problems. So that's we need to start by understanding that's what we have to do, to try to solve the problem for the child in as much as we can solve it in a medical sense. We'll talk a bit about probability, because those two things, deductive reasoning and probability, are a lot about how to think critically in pediatrics, and we'll try to talk a bit about those things throughout the year. It's when you're learning pediatrics, it's not just about the clinical treatment of a disease, but it's also the public health dimensions of that disease. So when we're talking about pneumonia, for example, it's not just about which antibiotics to use, but it's what causes children to get pneumonia, which children are more likely to get pneumonia, among a group of children with pneumonia, which ones are more likely to have certain pathogens and others have other pathogens. For example, there are public health dimensions of all the diseases we manage, whether it's pneumonia or TB or HIV or dysentery. There are public health dimensions of all of those. And I think part of learning about pediatrics is not just learning about the disease itself, but the public health dimensions of those diseases, prevention and other things. We'll also, I hope that throughout your training, you'll learn not just how to be a clinician, a good pediatrician, but also how to teach others. And I think it's by teaching others that we can learn the most ourselves. So I'd encourage you, the things that you learn throughout your training as the weeks and months go on this year, then try to teach them to other people, because it's a great way to learn yourself. And as I said, we'll try to cover the issues about how to solve problems, because much of what we see every day on our ward rounds is a series of problems, and some of which we can't solve and some of which we can solve, and some of which we need to think hard to find ways in which to solve. And so much of pediatrics is about problem solving. And we'll talk a bit about ethics as well. So all of these, we often focus on the diseases, diarrhea or malaria, or even the pathogens, but in reality, pediatrics is broader than that. And it's not just about diseases, but it's about these other things too, how to think critically, public health dimensions of different diseases, how to teach others, how to solve problems, and ethics and that sort of thing. Yeah. There are so many ways to learn, and I want you to be multifaceted in your approaches to learning. And there are so many different opportunities to learn when we work in busy hospitals that have lots of clinical material, that is patients with lots of interesting or rare or unusual diseases, or even common diseases. There's so much to learn, and there's so many different ways. There's many ways to learn at the bedside. I'll go through all of these actually. We can carry a guideline with you and refer to it often, so you learn how to use that guideline in everyday clinical practice. That's a very important point, thing that you should do right from the start of your paediatric training. You can attend or view the weekly lectures. You can read a paediatric textbook, and I'll explain what's a good textbook and how to read it. There are regular case presentations and discussions. I mean, the Tuesday morning case presentations that Dr. Toti runs are very useful because they discuss a clinical case, and you get to go through that and try to solve the problem for that particular case. So having case discussions either in a formal sense or informally with the teams that you're working with, or your peers, your colleagues, I think is a very good way to learn. You can keep a logbook, and I'll explain a bit about that. You can attend mortality and morbidity meetings. I think they're very important opportunities for learning, and they should all have an education component where you can learn the lessons from that particular case and incorporate that into your learning. You can learn by teaching others. As I said, the best way to learn, one of the best ways to learn, is to use your knowledge to teach other people, and that's why you learn more. They often give you feedback about the way, the things that they know, and so therefore it becomes an open discussion. You can join a study group. So many of the registrars in recent years have formed small study groups that they, with their friends, they study together. You can read journals, and I'll explain how to do that. You have to do your research project, and that's a way to learn. And then there's other things, online resources and podcasts and etc. that you can listen to and view. So there's so many ways to learn, and I find I learn best if I don't just learn something in one way, not just by reading a book, but also by reading a book and then discussing with other people and seeing a patient who's got that disease and then reading around it and teaching others about it. So that if you learn in multifaceted ways, then it really embeds the learning in your mind, I think. I said you can learn at the bedside, but the first thing to learn when you're studying pediatrics at the bedside is how to talk to children. You can learn lots about the content of their illnesses, but firstly, you should try to learn how to talk to children. And I think that the best way to learn this is to watch other people who can do it well. But there are some things that you can do that right from the start, even if you're a bit nervous about children, then you can ask questions that make you feel more comfortable and make them feel more comfortable. So when I'm talking to children at the bedside, I always ask quite familiar questions that I think that they, depending on their age, will make them feel comfortable, that I think they probably would know, and that make them feel safe. So it's easy to ask, how did you sleep, when you're doing a morning ward round, because sleep is really hard to get in a hospital. And if you ask them how they slept, it indicates to the child that you're actually interested in their well-being, not just their illness. And it's something that they will have thought about if they didn't sleep well, etc. So depending on the age of the child, you can ask them, how did you sleep last night? Or are you hungry this morning? Have you eaten anything? These are simple things that all children will have an interest in. They're more interested in those things than they are about their disease, usually. I often tell children at the bedside the time of day or the day of the week because when you're in a hospital, it's often hard to remember the day or the time. And I think that's important because it helps to orientate the child, but also it's talking to them about normal things. And it's not talking to them about their disease or their illness or their treatment, but it's showing your interest in them as a person. So I sometimes talk to them about the weather, if there's storms or the rain or it's a sunny day. I try to orientate them. So I tell them that they're in the hospital, but they won't be here for long, or I just try to orientate them to where they are in time and place and person, right? I ask them about the things that they will know something about. So I try to, when I'm looking at a child based on their age and that what appears to be their developmental stage, then they'll know the answers to these questions. Do they have siblings? Have they got brothers or sisters? What do they like doing at school? Or what sports do they like to play? Or sometimes they will do, you can compliment them on their clothes. If they're wearing a nice t-shirt, you can comment on that. Or sometimes they'll have painted their nails. A girl will paint her nails, or a boy, and you can comment on that. Or if they've had a bath and they've washed their hair, then you can compliment on those things. Children will appreciate that you do that, and that just really puts them at ease, and it allows them to then have confidence in you, and allows you then to have a discussion with their parents about their disease. I generally, unless it's not going to happen, I generally reassure the children that they're in hospital and they're here because they're unwell, but they're going to be home soon, and that the parent will be with them all the time. You know, that just those phrases can help put children at ease. And at the end of it, I always ask the child if they've got any questions. Of course, you don't do it if they're under a year of age or 2 years of age, but, you know, an older child, a school-age child, even a child of 3 and above, you can talk to them like this to put them at ease. And I think it's when we do that, then we can actually start to gain the most information about the illness the child has, rather than launching straight into the disease or the illness that the child has. So you can, when you're learning at the bedside, you can learn how to talk to children, and you can learn how to examine children. And if you've seen me examine children, I always get down to their level, right? If you get down to their level, to their eye level, right? If you kneel down like this in this picture, it's not threatening to the child. If you're standing over them and they're lying down and they're looking up at you, it's very threatening, and of course they're going to cry. But if you're non-threatening to them, especially for older children and younger children, if you're looking right over them, it's very intimidating. You also get more clinical information by doing that, by kneeling down or by squatting down and getting at the child's level. And then you don't strain your back, because if you're leaning over a bed and you're trying to examine a child, then you strain your back. And I'll tell you, as years go on, it's not very good for you. But if you can keep your back straight when it seems like a simple thing, but if you can keep your back straight when you're examining children, then you'll look after your back, which is very important. When you're examining children, you can be opportunistic, right? So unlike in Davinia, would you mind? Thank you. When you're examining children, you should be opportunistic, and that is, you don't have to do the examination. I mean, most of you know this, but you don't have to do the examination in exactly the right order. Whereas if you are looking after an adult, you know, it's best to do it in the right order. But it takes actually a bit more thought and a bit more work to be opportunistic, because you've got to think of what parts of the examination I can do now, and I can do now while the child's asleep or while the child's calm, and leave the parts of the examination that are most likely to upset the child until later. You may still have to do those things, but you can do it later when you've got the confidence of the child, or when you've done all the other things. When you're being opportunistic, you still have to be systematic. And so that means when you're examining the child, if you're examining the chest, you still have to examine the front and the back and the axilla and up and down. So all the quadrants of the chest, so that you've examined the chest thoroughly, and you have to percuss and you have to auscultate. So it's not that you can just put your stethoscope on one part of the chest and think you've examined the chest because it's opportunistic. You still have to be systematic, right? And you should try to be fun. You should try to enjoy examining children. And I think it's obvious when you get to the end of the year or to the end of your training and you haven't examined a lot of children. And I would encourage you just to enjoy examining children and realize that there are always children that are going to cry no matter who examines them and no matter how hard you work. But there are things you can do to put children of all ages more at ease. And so you'll get more clinical information and yeah, you'll be able to manage the children much better. So you can learn at the bedside how to talk to children, how to examine children, and then you can read around the diseases or the problems that you see every day. So while going to lectures is important, that's a systematic approach to learning based on a full curriculum. You can see lots of diseases and problems that won't come up in exactly the same way in a lecture, and you can read around them and you can discuss cases together and define the key questions and try to address the problems that you see. When you're reading a textbook, there's two ways to read a textbook. One is a comprehensive reading where you start at the start and go to the end, or you read an entire chapter. And the other one is an opportunistic way where you find a patient that you're managing and you identify certain problems and you really want to address a particular question. So you look through the textbook for that particular, to answer that particular question. And you can do that through textbooks, but you can also do it through PubMed searches or online searches. And I would encourage you all to start to do PubMed searches for specific questions. And we'll go through this, but to learn how to search for clinical questions through PubMed, it's easy and it's accessible and it's actually very useful. And you can ask a professor or someone senior for a tutorial on that problem that you're seeing at the bedside. So it's another way of what you learn at the bedside becoming more ingrained in your mind and adding to your file of learning. All right. I said that you should carry a guideline with you and refer to it often. And part of that is to learn how to use clinical guidelines in everyday clinical practice. I think it's very important that it's not intuitive that we always understand how to use clinical guidelines. And I think the more you learn, more you use a book like this, the Standard Treatment Book or the Pocket Book of Hospital Care for Children, they're complementary, and they how you use this guideline is very important. So just learning how to navigate the guideline and how to find the things you want and the answers to the problems. So you need to learn the structure of the guideline, how to navigate it, how to make diagnoses, how to find treatments for particular diseases. There's an app version of the guideline as well, which you can use. You can put on your phone. I talked a bit about pediatric textbooks before and different ways you can read them. There are many different pediatric textbooks. I looked at this a couple of years ago, trying to find the best, cheapest, most useful and up-to-date textbook. And I think there's several to choose from. And so I'll go through the three that I think are really worthwhile. The first one is, I think this one, the one with the sunflower on the front cover and the bee, the Illustrated Textbook of Pediatrics. This is from the UK, and it was last updated in 2021, so it's very current. And so I think this is probably the most useful book, and it also happens to be the cheapest of the books. It's a textbook for students and trainees. It's not fully comprehensive, but it contains everything that I think people at a diploma or a master's level really should be knowing. And this is the sort of book that you'd be able to read from the start to the finish. But there may be other larger books that you would delve into with a particular problem, like Nelson's textbook or something like that. But you could read this in a relatively short time from start to finish. The other one that's quite good is called Practical Paediatrics. This is very good. It's by Mike South and David Isaacson. It's an Australian book, and it's more expensive. At least the last time I tried to buy it on Amazon. I think that was the way I tried to buy both of these, and it's $170 compared with $60, which I thought was pretty good value for a very current book. Practical Paediatrics is quite old now, so it's over 10 years old. And so I don't think this wouldn't be my preferred option. I would go for this one. And then there's another one called Essential Pediatrics in Child Health, also quite old, over 10 years of age. It's from the UK and Israel, and but I wouldn't recommend that one as much as I'd recommend this one, Lisua and Carroll. I think that's probably the best book. And as I said, there's two ways to read a textbook. One is just you delve into it when you've got a particular problem in a particular patient. And the other way is you start at the start and go to the end, and you make notes along the way as you're reading. And that's what I think every one of us has to do at some point during your training. You have to start at the start and go to the end and make notes along the way. And it's a good way to, it's a good discipline to do. And I think, I'd encourage you to do that sometime, start early doing that. There's many resources online, and I just point you to the Paediatric Society website. It has lots of things that you can use for your learning. It has all the guidelines that I've mentioned. It's got the Pediatrics for Doctors in Papua New Guinea, another very good and very practical textbook. Out of print now, but the PDF is online. It's got the standard treatment manual and the WHO hospital care for children. This is a very important book, the Pediatrics for Doctors in Papua New Guinea. It's very practical, and it tells you a lot of practical procedures that many people have forgotten, actually. So I'd encourage you to it's a sort of book that you can delve into when you've got a clinical problem, and you can identify that clinical problem. It's usually only a page or two about each problem. I'd encourage you to read that one. And the website has the curriculum, the DCH and MMed curriculum, which I've just outlined. It also has other resources like the National Child Health Plan, which at some stage you should read. And that's been revised, as many people know, and relaunched last year for 2021-2030. And I think if you read that, you get to understand that interface between clinical practice and public health, that overlap between the clinical things that we see and the public health dimensions, and that's, it tells you a lot about what being a pediatrician is all about. We also have online all the lectures, so there are links to the lectures and the PDFs of all the lectures. And then there's other tools for pediatric surveillance and for morbidity and mortality meetings. All of these things are important in your learning. So I'd encourage you to explore the website in detail and see if you can find things on there that'll help you. The pediatric lectures are all there, at least from last year. There's YouTube videos of each of the lectures. You can go through those, especially if you missed them. And all the lectures for this year will be up online at some stage, usually the week after the lecture is given. The treatment guidelines I mentioned are there. We also, in addition to the standard textbooks, we also have other treatment guidelines. So we have guidelines on drug-resistant TB and HIV care. We've got other clinically useful tools such as growth charts and for weight and length and head circumference. We've got the infant record book, which is very important. We've got pediatric cancer protocols. There's a lot of information on the website that you'll be able to find, and I'd encourage you to use that as a primary source of information for getting guidelines and tools. There's a number of training modules online as well. So the hospital care for children training modules, which each of these, if you click on these, you'll find a PowerPoint presentation that goes through a case, and you can study the case. It only takes about an hour to do each case and to read through it, and that will help you understand how to Navigate the Hospital Care for Children book, and it also teaches you a framework for managing all sick children. So I encourage you to both do that course, but also have a look online at these different modules. Each chapter in the book has a module, and you'll be able to see them online. You should try to participate in your child morbidity and mortality meetings, your M&M meetings in your department, and you should try to present cases, read about the diseases, and then identify the lessons that you've learnt from the cases and try to teach other people about those lessons. And as part of your paediatric training, learn about quality improvement. It's important. That's an important other dimension to paediatric training, is quality improvement. I mentioned about child death review meetings or M&M meetings, and there's a lot of tools online on the Paediatric Society website on how to conduct M&M meetings. I think M&M meetings are really important for not just your learning, but the learning of your department and your hospital, and the health service in general, about why children get sick and why they die and what we can do about it. So this is becoming an expert, having expertise in audit and pediatric mortality and morbidity review is very important for your learning. So I'd encourage you to be fully participate in the M&M meetings in your hospital. We have online also the annual child morbidity and mortality reports, and if you read one, just go online at some stage onto the website, the Paediatric Society website, and download the 2021 annual report and read through that, because that will tell you a lot about the disease burdens that is seen in all the hospitals, and a lot about the problems that you'll identify and how to address them. So please have a look at those at some stage this year. We'll talk more about that as we go through the year. You should aim to present a case every month and to attend the PMGH Tuesday morning case presentations. I thought last year they were excellent, and covered a lot of ground. A lot of different cases were discussed, and I think they taught everybody who attended a great deal. So try to get to those, but also have case presentations in your hospital and present to your residents and nurses and your consultants, your SMOs, and read around the topic and summarize the topic and identify the specific problems for that child, and try to discuss any difficult or complex case you should discuss. And we might try to incorporate some case presentations and discussions into this teaching as well. I found that quite useful when we did it a couple of years ago, and we might try to identify a time when we can do that during each week. A few years ago, maybe 8 years ago, we introduced a logbook. And I think the logbook is a very important aspect of pediatric training. It's not something that you can fill out in a few months or even a year. It's really meant to help you through your 5 years of pediatric training, to help document the training from your DCH right through to your MD. And you can record details of procedures that you do and that you learn, the cases you manage, the courses you attend throughout your training and your research projects, and the rotations that you do in different hospitals and in different specialty areas. I think it's important that you try to document your pediatric training, and you can put it all in your logbook. That's also online. You can download a logbook from, if you don't have a hard copy, you can download and print one out. But try to do that, because I think it's useful at the end of your training to have a logbook that documents your training. It's also useful for your supervisors to look at your logbook and see the things you've done, and it's a permanent record really of your training. We got this idea largely from the surgeons and the anaesthetists who keep logbooks of their procedures that they do. And I think this is a very important aspect of training, so that it's not just something you remember, but something that's really well written down. So all specialties should have a logbook as part of their postgraduate training, I think. All right. It's like a diary. I've gone through this before. You can't remember everything you've done or everything you've seen, so write it down. Just even if you spend 15 minutes a day just writing down the things you've seen or done, or writing down a case once a week, that's all you have to do. And that way you build your knowledge slowly, it starts with one or a few cases, and then you build and build and build further on that. And by the time you've finished your training, you'll have a whole library of cases that you've seen, and procedures that you've done, and lessons that you've learned, meetings that you've attended, courses that you've attended and completed. All of those things can be then documented in your logbook, and it's a permanent record of your training. You should, throughout your training, try to read paediatric journals. And again, there's many different ways to do this. You can do it in an opportunistic way, just through a search on a particular problem, find a journal article that you are interested in, and that relates to one of your patients, for example. That's one way to do it. And the other way to do it is to try to get hold of a journal and just scan through it and read the articles that interest you. And so I think there's a few that are quite relevant. And the one that I like the best is Archives of Diseases in Childhood. Now, I like that the best because it's very broad. It covers a lot of things. It's not just about tropical pediatrics or any, but it covers things that are happening in different countries as well. And I think it's important that we have a breadth of knowledge, that, of course, you understand everything about pediatrics in PNG, but also have an understanding of the trends in pediatrics in other places. And so now, not all the articles in these journals are available freely online, but some of them are. And so I'd encourage you to try to read a journal where there's a lot of articles available free online. The other ones are Pediatrics in International Child Health. I think that's a very good journal. An excellent journal, but again, it's not all the articles are available free online. The Journal of Tropical Pediatrics also has clinical articles that are relevant to pediatrics in the Pacific, very useful articles. Again, some are open access. That means they're freely available, and some are not. You can access almost any journal article through HINARI. That's called HINARI is a WHO initiative, Health Information Access to Research Initiative. Now, if I know the School of Medicine is a member of HINARI, and many of your hospitals will also have signed up to HINARI. It doesn't cost anything, but you do have to register as a hospital or as a educational institution to sign up, and then you can access tens of thousands. It's about 14,000 different journals through HINARI, and certainly all the common pediatric journals are accessible through HINARI. So I'd encourage you to talk to your DMS or your librarian, if you have one, about signing up for HINARI. That's one way. You can't read the entire journal, but you can find articles and just read those articles. But if you ever get a chance to, just get a copy of a journal like Archives of Disease of Childhood and read through it, you'll get a good feel for current trends in pediatrics, I think. So I just encourage that. Now, I want to just say a couple of things about your supervisors and your teachers and your mentors. It's very important that you have good, get in contact with your supervisors early and show your enthusiasm, so that they'll teach you. There is a bit of a difference between a supervisor and a teacher and a mentor, and I just wanted to go through those. Sometimes the same person can be all three things to you, and sometimes they're different. And so your supervisor sort of oversees and supports and instructs and teaches you and sometimes assesses you through your training. And that might be the SMO who's, who you're working under at the time. A teacher obviously is also a supervisor, but the teacher teaches you in lots of different ways, in formal and informal ways, and you'll have many different teachers throughout your training. And then a mentor is a little different, but a mentor has a different relationship with you. It has a supportive, that person has a supportive and advising relationship. Now, this may be a colleague who's a senior trainee. If you're doing your DCH, you might find a mentor in an older trainee or a recent graduate, someone, or even someone who's a very experienced pediatrician, who the point is that they have an interest in you as a person and an interest in your learning and your training. Sometimes it may be a mentor can be in another discipline. You might find a mentor as a junior anaesthetist or someone who can mentor you, or a surgeon or a physician, or another registrar. The point is to have someone who's in a supportive and advising relationship who can support you as you go through your training. And it doesn't have to be the same person all the time, but and it can be your supervisor or your professor or whatever. Those people can be mentors as well. But I think it's very important that we don't just have supervisors who do the assessment, but you have to have people who are interested in teaching you, people who are interested in mentoring you throughout your training. So you should seek out someone who's interested in you as a person and who's willing to understand and to help you along the way through your training. Now, finally, I said this at the start, but postgraduate training, no matter what the specialty, it's a marathon, it's not a sprint. And I hope that, throughout your training, you'll just take your time. There's many people who go through their training and they may need to take some time out at various times because they, for whatever reason, for other things that get in the way of their training. They may have a baby or become a parent and they want to take some time out, and that's fine. There's nothing wrong with that. It's a long time you're training, and you really need to be taking your time and being kind to yourself, because a lot of the things that you see in pediatrics, sometimes pediatric training is quite tough, and you'll have days that are sad or confronting. You'll be looking after patients that are really challenging, and sometimes you might even doubt yourself. But that's where you need people to support you and to support you and mentor you through those difficult times. You should know that during your training, there's always someone that you can talk to. Most people throughout their training at some stage get a bit stressed or feel challenged, but there's always someone you can talk to about that. And so throughout your training, you need to look after yourself and to look after each other. And you should try to be happy and enjoy your training. That 5 years is a long period in your life, and during that time there'll be other important people and things in your life besides your work and your training, and you need to try to have a balanced life in those times. So look after yourself and look after each other. And that's all I wanted to say today. But I'm going to stop sharing my screen and answer any questions that you might have.